you have to always go from your experience of what you know. I'm a trained internist. Uh, I have been doing this for, as I said, for about 40 years. So I feel a bit comfortable in the management of non-communicable diseases. Now, let me make one point clear. It doesn't mean we're not going to address communicable diseases, which is very prevalent here, the malarias, the typhoid. Yes, we are going to. What we are saying our emphasis is going to be in the prevention and management of complications from those non-communicable diseases. You know, when it comes to this, and let me specifically say diabetes, hypertension, but even coronary artery disease, which is again narrowing of the arteries that supply the heart also, you know. It takes a team, and usually I refer to the team as you, the provider, the patient, and the patient family. When the patient diabetes is not controlled, this is what I tell the patient. Either I'm not doing a good work as a physician, or you're not doing your part to do the things to be able to control your blood sugar. So let's look at the numbers and let me tell you what I'm doing. So if it is my fault, I'll make the adjustment and do the education. So you got to exercise, you got to eat well, you got to take your medications, you got to comply with your visits. That's your part. We get families involved, the food preparer, usually the spouses, the caregiver, and because they're involved in preparing the meals. The expected service delivery, we are going to be able to provide inpatient care and outpatient care. We have imaging in the form of x-rays and sonography. We do have even a portable sonograph that you can carry from room to room and do sonographic examination, ultrasound examinations. We have the capability of a bedside echocardiogram. I'm not a cardiologist, but I've learned to look for certain things that I can be able to diagnose emergently. We have we have a consultant in radiology locally who will be, he's not employed by the hospital, he will be an independent contractor that will be doing our imaging, putting our imaging report together, and also has volunteered on every Saturday to go and do our sonographies, our ultrasounds. So we are starting with 10 nurses and see how that goes in the next 3 months, in the next 90 days. One medical officer, a community health officer who's a mid-level, and we have a pharmacy service, we have a laboratory. We just bought a new biochemistry machine and a new hematology machine for blood counts. And we brought the autoclave machines from the States and a few other accessories. So these are some of the services. In the future, we also, additionally, we have a labor and delivery. So we'll be doing that. We've already employed a midwife and an assistant to that midwife. I'm going to be engaging the medical officers have experience in labor and delivery. They've practiced here for some time. Dr. Adrian Bobo, who has managed my clinic here in town since 2012, will be also the medical officer there who has a lot of experience. And then we'll be partnering with and talking to some of the local specialists in OBGYN to see their interest in consulting with our patients and with our physicians.